Hi, I'm Marie Story, Corporate Wellbeing Consultant and Team Leader at Walsh Duffield Companies and a Certified Health Education Specialist. Today I'm here to talk about stretching and flexibility in the workplace. And why are we talking about this today? It's because of the background of injuries in the workplace. Every day in the US, 9,000 workers suffer from a job-related injury. And musculoskeletal injuries are the most common in the workplace, accounting for 37% of all of these injuries. Even further, back injuries, as I'm sure we can imagine, account for 1 of every 5 workplace injuries. There's a strong relationship between work and our health. At work, we're often exposed to risks that can cause injury. So ask yourself here, how does the work I do affect my health? Do I have to sit for long periods of the day? Do I have to stand in one place? I used to work early on in my first job as a cashier at a grocery store, and I stood in one spot for long periods of the day. And that did take a toll on my legs and can lead to things like varicose veins. So it's very evident that the work you do affects your health. Does the pain increase when you do your work? Maybe it's related to repetitive movements or improper lifting technique. And overall, what can you do to protect your health on a proactive basis? A little bit more on these risk factors on the job. Things like repetitive movements, maybe you type at a keyboard all day long, or you work in a manufacturing environment where you're doing the same motion over and over. Maybe you have to do forceful movements or excessive movements for long periods of time where you're in an extended awkward reach. Maybe you have a fixed or awkward posture in the position that you're commonly working in. Or maybe you're bending, twisting frequently, and there's heavy lifting as part of your job. Maybe you work in a nursing facility and you have to lift frequently throughout the day. These can all be primary risk factors for workplace musculoskeletal disorders. There are also secondary risk factors, things like contact pressure. If you type on a keyboard all day, are your wrists resting on the hard surface of your desktop? Are you exposed to a cold environment? This could even be in an office or at home. The heat might be lower, or you work outside. And maybe you're an infrequent heavy lifter. You don't often have to lift for your job. And if you do, this means that there's an increased risk for injury because you're not used to it. All of these can potentially lead to musculoskeletal disorders. And a musculoskeletal disorder, or MSD, is an injury or disorder of the muscles, the nerves, tendons, joints, cartilage, or spinal discs. Work-related MSDs are conditions in which the work environment and the performance of work contribute significantly to the condition, or the condition is made worse or persists longer due to work conditions. Common examples of WMSDs include back pain, which we talked about is the most common, carpal tunnel syndrome, arthritis or other joint pain, sprains, strains, and tears, or even hernia. There's a lot we can do, though, to prevent WMSDs, and we're going to talk about that here. One of the first is to implement flexibility strategies. Flexibility, as you can see here, is an important but often neglected part of an exercise program. On the left, it lists the fitness components like muscular endurance, strength, cardiorespiratory fitness, and our body composition. And again, flexibility is often pushed to the wayside due to time constraints, or maybe it's just thought that it's not that important. But the importance of flexibility for health and well-being becomes more important as we age. There's some flexibility fundamentals we need to know. And flexibility is ultimately the range of motion in a joint or joints, and that's used to reflect flexibility at that joint. So your range of motion is the extent and direction of movement that's possible, and it's very joint specific. Clearly, my shoulder joints move much differently than my finger joints, or my hip joints, or my ankle joints. So again, very joint specific to our body. As seen here, there's a strong influence of age on flexibility. The diagram shows a hypothetical pattern for changes in flexibility with age. Specifically, flexibility decreases when children are young, but increases as they move beyond puberty. Flexibility peaks in our mid-20s and then begins to decrease as the connective tissue is replaced with more fibrous tissue. The pattern of activity in the lifespan follows a very similar pattern, as you can see here. So it may be that the decrease in flexibility seen with age is more related to the corresponding decrease in activity. It's that old adage, use it or lose it. And this definitely applies with respect to flexibility. Therefore, it's really important to maintain flexibility just as we want to remain more overall physically active as we age. We need these physical activity components to keep our bodies strong and healthy so we can remain independent when we're in those 50, 60, 70-year plus age brackets. Of course, there's a long list of benefits of flexibility programs. There's an increased ability to perform your everyday tasks at work and then at home and in play and your hobbies. It provides a good mental break from the work routine, which results in a reduced stress level. Again, we talked about that decreased risk of musculoskeletal disorders. It lessens the joint wear and tear and reduces osteoarthritis, joint stiffness, and pain, which again happen with age. It improves our reaction time, our balance, and our posture. It reduces muscle fatigue and soreness, especially if we're doing heavy lifting or using our muscles a lot and they get tired and fatigued. Flexibility and then stretching can really help to reduce that soreness in the muscles. It decreases our risk of joint stiffness or pain to the lower back, the neck, the shoulders, the knees, hips, the elbows, the wrists, and the hands. And it increases energy, which results from that increased blood flow and supply of nutrients to the muscles, tendons, and joints. What are the basics? The basics are, again, the benefits. We want to increase our flexibility to increase the elasticity of our muscles, increase the circulation to warm up those muscles, improve our mental alertness, and reduce fatigue. And then again, decrease muscle tension and stress. When do we want to stretch and increase flexibility? You can do it prior to starting your day, during short breaks, after breaks or lunch to prevent fatigue. If you feel tension or stress, maybe you've been sitting at your desk all day and you're feeling a lot of tension and you're in between your shoulder blades, or after a lengthy task where maybe you were stuck in an awkward position for a long period of time. The key here is that you can really stretch any time of day. Proper stretching techniques include making sure to relax and breathe normally when you're stretching. Never hold your breath. A lot of people tend to want to hold their breath when they stretch or exercise into a movement, and you want to make sure that breathing is a key part of your stretching routine. Hold each stretch for a count of at least 15, or as long as you can maintain comfort. Use gentle controlled motions, don't bounce in stretch positions, and keep the knees slightly bent for better balance. Sometimes stretches require us to use our balance and coordination, so it might help to have a chair or wall nearby. And stretch until there's a mild tension felt, and then relax. And again, stretch by how you feel and not how far you can go. This is a common one I see in yoga. People always want to be able to reach the floor or twist all the way, and it's really not about how far you can go, but how you feel when you're doing the movement. How much is enough when it comes to this? Stretching exercises should be done regularly to achieve optimal benefits. But again, if you haven't been doing any stretching, just starting out with a couple of days a week is a huge progress in terms of your routine. For flexibility to be increased, you do have to stretch and hold muscles beyond their normal length, so we want to feel that mild discomfort. Performing warm-up exercises is not the same as doing a stretching workout for flexibility development. And the best time to stretch is when the muscles are warm. We talked about that secondary risk factor of cold exposure. We don't want to stretch muscles that are very cold, as they're not going to be very elastic, and we can actually increase our risk for injury. Here's a little fit formula for stretching, and I'm talking here about static stretching or more traditional stretching that many of us can probably do right now. You want to do it at least 3 to 7 times a week. And again, you want to stretch beyond the normal length of the muscle to that point of mild tension or discomfort. And for the time period, you want to hold 15 to 60 seconds and repeat 3 to 5 times, giving yourself a little bit of rest in between each stretch. A few more guidelines for safe and effective stretching exercise include not forcing the stretch to the point of pain. There should never be pain with stretches. Choosing safe exercises. I talked about balance, and if balance is an issue for you, making sure that you have something nearby to hold on to. We don't want you to fall over or hurt yourself when stretching. Avoid overstretching weak muscles. If you know that your back is an area of concern for you, you probably need to do some core strengthening as well as stretching. Just stretching alone isn't going to solve the back problem. And then again, use good technique. Keep those knees slightly bent and a wide base with the feet to keep you stable in all stretches. Let's all get up and do a little bit of movement here. We're going to start with a forward bend, which is great for the hamstrings and lower back. What we want to do is, again, start with that wide base. Our feet are about hip width apart, knees are slightly bent, hands behind the head. And what we're going to do here is keep the legs fairly straight and the back straight, and we're going to gently bring chin and face towards the floor, trying to keep the upper body parallel to the floor. Maybe this is enough for you. Maybe you're able to take it a little bit lower. And as you exhale through the mouth, coming back to standing, we're going to dynamically move here. Inhale as we lower. Exhale as we stand. Good. Just gently moving through the movements here. Again, we're not bouncing. We're trying to be nice and fluid here, pushing through the heels as we stand. Inhaling as we lower. Nice flat back. Exhale as we come to stand. And last one here. Inhale. And exhale, coming back to standing. And if you have more time, you can certainly hold that position with your chest facing towards the floor for a more extended period of time to get even more stretch into the hamstrings. Moving here into a glute stretch. We want to also focus here on stretching into the glutes, and this is a great opportunity to use a wall for balance if needed. All you're going to do is bring that knee towards the chest, and we're gently clasping below the knee. We never want to pull on our joints. We want to keep very mindful of our joints, that we're holding on to the long bone here of the shin. And again, using the balance. If we find we lose our balance, we can certainly hang on to a wall. Breathing nice and deep, inhaling and exhaling through the mouth. Focusing on that breath. We're never holding the breath, using it to help guide our stretch. And taking it to the other side. Again, bringing with a nice strong core, that knee towards the chest, we're pulling it in. Exhaling out. Inhaling. Exhaling. And one more deep breath. Inhale. And exhale, bringing those feet towards the floor. Good. Now taking into one of my favorites, a lunge stretch, as we're going to stretch through the hip flexor, bring the front foot forward, and keep that knee in line with the ankle, making sure the knee doesn't track out over the front toes. We're going to gently drop the back leg, keeping the hands on the hips or hanging onto the wall for balance if needed, keeping the torso upright and the posture is strong. And we're just breathing here, feeling that stretch in the front of the thigh and the hip. Inhaling through the nose. Exhaling through the mouth. And one more deep breath. Inhale. And exhale. And coming to standing. Switching out the legs, again, making sure that the knee and ankle stay in the line. And making sure that that back leg drops. And we feel that nice stretch through the hip and the thigh. Breathing deeply again, in through the nose. Out through the mouth. My posture stays tall, hanging onto the wall if I need it. Inhaling. And exhaling. And coming back to standing. And wrapping up the lower body here, we're going to do a quad stretch. This is one that people often need a wall for balance, so feel free to hang on if you need to. And you're going to pull the left ankle into the hand. And we're just trying to bring that heel towards the bottom. Gently bringing it in, breathing into the stretch, feeling a nice deep inhale. And exhale, even deepening the stretch a little further if that's comfortable. Thinking again about posture, standing tall, inhale. And exhale. Good. Taking it to the other side. Bringing that back of that heel towards the bottom. Keeping everything in a nice straight line here. Breathing deeply. And exhaling. One more deep breath in through the nose. And out through the mouth. Good. Let's move a little bit into the upper body and the back. We're going to do hands behind the head here. You can clasp the fingers if that feels comfortable, and you're even going to push the back of the head gently into those hands. From here, your feet are again hip distance apart, slight bend in the knees, and we're just going to open those elbows up like wings, stretching across the chest, and then feeling those shoulder blades squeeze back and down as if you had a pencil right in between those shoulder blades, and you could squeeze it. Trying to relax the neck here by gently pressing the back of the head into the hands and breathing deeply. Inhale and exhale, giving you one more inhale through the nose and exhale through the mouth. And gently letting the hands down. From here, a shoulder stretch is great for really opening up the chest, the shoulders, which get tight if you're hunched over a desk or other work throughout the day. Clasping the hands behind the body, you're going to gently roll those shoulder blades back, reaching the fingertips towards the floor, however feels comfortable for you. Keeping that posture upright, in through the nose again, out through the mouth, in through the nose, and out through the mouth. Gently relaxing here, rolling out the wrists, the hands, the fingers. And finally, with some torso rotations. Our feet are again hip distance apart, soft bend in the knees. Hands are on the hips. We're going to gently twist towards one side, keeping those feet planted in the floor, feeling a nice stretch through the side of the waist. And exhale as we come to the other side. Inhale and exhale. We're dynamically moving here. We're not holding at this point. Just getting some nice mobility in the sides of the waist, a little bit into the hips, and breathing with every movement. Good. Inhaling and exhaling, keeping that posture tall to support your core. To the center, and last one this way, and center. Good. And now finally ending with a little bit of wrist mobility. If we're doing a lot of work with our hands, this is a great area to focus on and often forgotten about. We're going to just start with an up and down stretch. Again, flexibility is dealing with that range of motion. So trying to think about the range of motion of our joints and working it in different ways depending on the joint to make sure that we have mobility in all directions. So we've got this up and down, and now we're moving side to side. Good. Relaxing my shoulders here, making sure that I'm bringing my shoulders up to my ears. Good. In and out. And then ending here with a rotation up and down, working in a little to those forearms, those wrists, those hands. All of these little joints matter just as much as the big ones. And one more, and taking it down. Great. In summary, flexibility is often a neglected part of our fitness routine, but is really important as we age. It's very specific to our joints, meaning the range of motion is different for every joint in our body, and we want to focus on all ranges of movement for the joint that are appropriate so that we're able to move our body in all different directions. There's many influencing factors on the job that can lead to injury, such as awkward posture or heavy infrequent lifting or being out in the cold. It's important to be aware of what these factors are so that we can work on prevention. When it comes to flexibility and stretching, there's many health benefits from increased flexibility and elasticity of the muscles and joints to increased blood flow and nutrient delivery to those areas, as well as waking us up and providing a little bit of energy throughout the day. And again, try to aim for 3 to 7 days a week. If you're just starting out, 2 to 3 is great to start, but we really want to work up to doing a little bit every day for our flexibility to achieve the most benefits. I hope you learned something here about why flexibility is so important and a few stretches you can incorporate throughout your workday. As always, thank you for your time, and if you ever need more information, be sure to visit us at walshduffield.com for more information. Thanks and have a great day.